Hi there, this is Dr. Paul Firnhaber here at Lincoln Disc and Nutrition Center in Lincoln, Nebraska. And it's time for another 10 minutes of truth. So I've got another article that I want to cover today that I think is very relevant and very important article. I think they're all relevant and important, and this is no exception to that. This is out of a journal called Curious, which I've covered articles out of this journal many times. I like the journal a lot because they tend to publish articles that are very, very relevant to people's health. Their articles are not necessarily theoretical. They're just relevant to where people are at. And this is one of those. This is April of 2023, so it's a little over a year old. And the name of the article is called Pediatric Text Neck Syndrome. And I'm just going to read you some things and then make some comments on the article. It says the increasing prevalence of social media, mobile texting, video streaming, and gaming due to the widespread adoption of smartphones has led to the emerging health concerns, including the overuse condition known as text neck syndrome. And text neck syndrome is basically repetitive stress injury, just like, using a mouse on a computer over and over and over again until you get carpal tunnel. Well, text neck, just holding your head down and for long periods of time. And it's become a real concern in the pediatric population because of all these mobile devices. And it says in this article that prolonged exposure to poor postural habits in children may result in long-lasting musculoskeletal issues and a higher risk of spine-related disorders later in life, which is another way of saying chronic health conditions. It says over time, strained flex stress may cause posterior ligamentous laxity, vertebral segment instability. Spondylolisthesis is where one vertebra actually fractures and moves forward on another one, which we see on X-ray a fair amount. Degenerative joint disease, possibly leading to plastic impairment within the nervous system and causing clinical symptoms. Now, let me just explain this last section a little bit further. So when you hold your head forward and down for periods of time, what happens is that your head, which weighs about 8 pounds, tends to get an anterior head carriage and you carry it forward. What that does is it elongates and stretches the spinal cord and actually causes neurological problems. And this has been researched out. There are many, many research articles, published articles that show that this happens. And this is not good because we're talking about central nervous system issues because of what you're doing to the brain and the spinal cord. Every 10 minutes of static spinal flexion position can alter the neuromuscular and mechanical signals of the cervical structure. Now, I want to make a quick comment here, and then we're going to go back to the article. If we look at the health of children today, according to a journal called Academic Pediatrics in 2011, they said that 54% of American kids suffer from a chronic health condition. 54%. Now, if you go back to when I was a kid, back in the 50s and 60s, it wasn't even close to that. Very, very, very few kids suffered from chronic health conditions. So the reason I'm saying that is text neck can either cause that or contribute to it. Now, what are some of the symptoms that can come from this cervical spine disorders, from text neck syndrome or looking down too much? Well, headaches, dizziness, angina, and dyspnea, which means trouble breathing, so it changes your breathing. And you can even do this experiment. If you look forward like this, bring your head forward and down, take a deep breath, and then alter your posture where you're very erect and your head is over your shoulders, and then take a deep breath, you'll see that there's a very big difference. It can cause facial pain, fibromyalgia, visual disturbances, and cervical radiculopathy, which is, pain down into the arms. The article says chiropractors are educated to recognize structural or movement abnormalities that could cause injury or discomfort if left untreated. Manual therapy has demonstrated clinical benefits in correcting reversed cervical curvature. But we see that all the time in practice. And there are multiple articles, published research that show that what I just read is true. It says chiropractic manipulation is used to reestablish postural stability and correct spinal alignment by comparing pre- and post-treatment radiography or x-rays. Monitoring the pediatric population for development of text neck syndrome is crucial. The article says educational efforts should be directed towards promoting proper smartphone use habits and ergonomic adjustments among children to minimize the risk of developing text neck and other spinal health problems. Regular exercise and core strengthening programs should be encouraged to promote healthy spines and mitigate the potential adverse effects of excessive smartphone use on pediatric spinal health, which I couldn't agree with more. And I'm personally very, very much in favor of it. I do core muscle exercises myself regularly. These findings emphasize the importance of early recognition and intervention for text neck in the pediatric population. The potential benefits and limitations of chiropractic treatments, pediatric patient considerations, and the role of ergonomics and exercise in maintaining spinal health. So there you have it. That's out of a peer-reviewed published journal. I would recommend that you look at your kids, maybe you look at yourself and look at your posture. We check everybody's posture here that comes in on not only the first visit, but subsequent visits, and certainly every reevaluation. And I constantly am giving out and holding patients accountable to do postural exercises to bring the head back over the shoulders and reduce this text neck syndrome that so many people have. So that's all I have for today. I hope that you pay closer attention to your posture. And I think that if you do, and if you know people have some real postural issues, you could send them into my office and I could really help them, give them exercises to show them how to rebalance their posture and change things in their spinal column. So that's all I have for today. If you're interested in learning more about this, give our office a call at 402-488-2220. We'd love to talk to you about it and give you a preventative health screening to see if we can help your posture. So we will see you soon. Next Wednesday, we'll have another 10 minutes of truth.